Thank you, everyone, for joining us this evening for the Comprehensive and Community Support Waiver Renewals Public Forum. We'd like to make a quick housekeeping note. As the presentation goes along, you'll be asked several times to please submit questions, anything that you want to share during this presentation. We ask that you do that in the Q&A box if possible. That way all of the panelists can see the questions that come in. If for some reason you need to use the chat box, that's fine. Just make sure that you select that it goes to all panelists or to all participants. Again, just to ensure that everyone can see those questions as they come in. And with that, I will turn that over to our presenters and allow them to introduce themselves and get started.
Hi, Heike, thank you so much. We really appreciate it. This is Angie Brenner with the division. We welcome everyone tonight to our Comprehensive and Community Support Public Comment Forum. With the 2016 waiver renewals, we were able to travel around the state for this type of forum, and although we're not able to do that today, we appreciate the opportunity to do this with you virtually. So please bear with us as we navigate these new waters. We want this session to be as interactive as possible. So as we go through the slides, we'll continue to look at the chat box and the Q&A box and try to address as many questions as we can. If we miss yours or we don't get to it, please do not worry. We are going to collect all the questions and still respond to those after the webinars. So we will start our evening off. Your presenters tonight are myself, Angie Brenner, and Leslie Bradley, and we are from the Federal Programs Unit in the Division of Developmental Disabilities. And then we also welcome our new additions technical assistance team, Janine Zalaki and Barb Barnes. In a couple of slides here, in the next couple of slides, we'll have an opportunity for them to introduce themselves and talk a little bit more about their technical assistance with us. So again, we really appreciate your time with us tonight. We do have a few panelists that will assist us with answering questions, and that would be Dwayne Shoemate and Kim Stock. So as we get to those, if we need assistance from them, they will be helping us out as well. Okay, so tonight we are going to review several topics. We're going to do a renewal overview, so basically what our renewals are. We're going to talk about a program change document that we have posted on our website. We're going to tell you about new waiver services. We're going to introduce the 1915B4 selective contracting waiver. We're going to talk about definition clarifications we're making, and then changes to definitions and limitations. We're going to talk a little bit about seclusion, and then we'll talk about performance measures. So again, as we go through these slides, feel free to send us those questions, and we'll go through them and try to address them as we go along. Okay, so home and community-based waivers, as many of you know, it's a waiver application that allows the state of Missouri, our division, to use Medicaid funding for home and community-based services for individuals with developmental disabilities. The last comprehensive and community support renewal waiver application was approved by Centers for Medicare and Medicaid Services, effective for July 1st, 2016. Centers for Medicare and Medicaid Services is the federal government partner that provides us 60% of the funding for the services we provide. The next renewal date for both of these waivers, comprehensive and community support, is due on July 1st, 2021. And again, that's because they're only approved for a 5-year period. When we start to work on these waiver renewals, it begins well over a year in advance. So it takes a lot of time and stakeholder engagement to put these together. So with that, I want to introduce to you what we have done with our services advisory team. So in 2008 and 2019, we convened a services advisory team that included self-advocates, families, providers, targeted case management entities, and state staff from our single state Medicaid agency, MoHealthNet, as well as our Medicaid audit and compliance unit. So they were a part of it. And they, oh goodness, okay. Heike, we may need your help. They're saying slides are not advancing. Can you tell if they're advancing yet on your side?
No, they are.
Okay.
I got it to you. Let me transfer the ball to you. That is my mistake, Angie. You are now going to be the presenter.
Okay. Thank you. Okay, so apologize for that, everyone. We're going to catch up here. So our service advisory team convened in 2018 and 2019. And so we met over that 2-year period. And again, that included self-advocates, families, providers, targeted case management entities, and state staff. And we took that opportunity to review renewal opportunities to enhance the service delivery system capacity and to increase individuals' independence. We want to really thank all of those that spent so many long hours working on the renewals. We really appreciate the time that they put into this. And then as you'll see in the renewals, we think that many good changes were made with this team. So additionally, CMS granted new additions to provide technical assistance during our waiver renewal process. And the new additions team has provided a wealth of information and guidance to support best practices here in Missouri in our waiver services, as well as helping us to develop clarifying language for our waiver services. So at this time, I would like to invite Janine and Barb to introduce themselves and then share their experience and insight with us. Janine and Barb.
Janine, why don't you go first?
My name is Janine Zalaki, and I am so glad to be with you here tonight virtually, although I love coming to Missouri. We're all getting used to doing many of these opportunities in other ways. I hope we can still connect and that you ask as many questions as you'd like. We have been very lucky to be working with such a great team in Missouri that are on this webinar tonight to really just be a guide to the good work they're doing with this waiver renewal. And by guide, I mean to really help them parse through the CMS technical guide and rules around waivers and waiver renewals, as well as to help bring some insight into what we see happening across the country with regards to services and supports that comport with the CMS community rule to ensure that everyone has access to the community, to seek employment if they wish, and to continue this terrific person-centered system that's here in Missouri. So thank you so much.
And I'm Barb Brent, and also with the technical assistance team. I'd like to echo what Janine said about the really good things going on in Missouri and how wonderful the team that you have there is to work with. And we're sorry we couldn't be with you on site. We love coming to Missouri and meeting everybody there. I see a few names I'm familiar with. I didn't scroll all the way down, but hello to a few of you. I haven't seen you in a while. And some of the other things that we got to do in working with the Missouri team and the Service Advisory Group as well is to listen to what Missouri hopes to achieve in your vision and your values and wanting to move the systems toward increasing integration even more, to looking toward really what supports people to have good lives and supporting people in the context of their families, looking at what history is and honoring history, but still moving forward. We pulled lots of information from different states that have helped people spend more time in the community and really help direct their lives, whether it be at work or away from work, or spending more time on their own in homes more like their own if they're not living with their family, and gave that opportunity for people in Missouri to think about how could you make any of those services or definitions their own to fit within what works in Missouri. So with that, thank you again.
Okay, thank you so much, Barb and Janine. I really appreciate that. They've worked hard with us the last couple of years, and so we do appreciate all of their expertise and guidance they've given us. So with that, we are going to dig a little deeper into our waiver renewals. And again, feel free to ask questions as we go along. We're happy to go through those with you as we work through the slides. So the waiver applications, when you look at those, they consist of a main introduction section and then 10 appendices. And in order to help our stakeholders review the changes within the appendices, we developed a document that we're calling our program change document. And this document is posted on our website along with the draft waiver renewals. And those program change documents provide brief descriptions of each appendix, as well as the significant changes that were made in those sections. There were some changes that were made just to clarify and align language with our other DD waivers. So with our Partnership for Hope and Missouri Children with Developmental Disability waivers, those changes we did not consider as significant, and so they were not included in the program change document, but you will see them in track changes when you look at the appendices themselves. And so to give you an example of what this document looks like, this is our program change document, again, posted on the website. It will have each appendix defined on what it includes. So for example, here we have Appendix A that's in the blue background, the blue shading, and it is the waiver administration and operation. So it tells exactly what is in that appendix. And then when you look for changes here under number 1, we have identified that we've made a change within that appendix, and it'll describe what that change was. So this one, it updated some performance measures for consistency across the waivers. So you'll be able to walk through, and it'll tell you exactly which section to go through. We're also going to use this document to assist us with stakeholder comment. You can see in the last column here, column for stakeholder comments. That's going to help us track comments and responses as we go through this process. So now that we've gone through the quick how-to session, we are going to dig a little deeper into the actual waiver application. So here we're going to start with our new waiver services. We are adding benefits planning and individual directed goods and support to both the comprehensive and the community support waivers. And then we're adding home delivered meals to the community support waiver, and then intensive therapeutic residential habilitation to our comprehensive waiver. And again, I'm going to show you a little bit of what that program change document looks like. Appendix C of a waiver application is where all the service definitions reside. So Appendix C will have the description, and then here you can see where we've said that intensive therapeutic residential habilitation, we've summarized that it's a new service, and we've summarized what this service does. If you want to see the details of the service and the provider qualifications, then you would look in section C1 of the appendix that's posted on the website. So again, this is a quick way for you to kind of go through and see what changes you want to look at in the actual waiver application. Much easier than scrolling through 400 pages of a waiver application. So hopefully you will find this helpful. So now we're going to explain a little bit more about those new services that we talked about. So again, we have benefits planning that we're adding, and that's really designed to inform the individual about competitive integrated employment and assist them to assess if it'll result in increased economic self-sufficiency through using Social Security and Medicaid work incentives. And then we're adding home delivered meals in the community support waiver only. And this is something some people may already be accessing. We've added it through our Appendix K, through a waiver for the due to the COVID pandemic that we're trying to work through right now. So home delivered meals is designed to offer preparation, packaging, and delivery of meals to individuals who are unable to prepare or obtain the nourishing meals. We're also adding individual directed goods and services, and this service offers flexibility and increased independence to cover support, services, and goods. And then we're adding intensive therapeutic residential habilitation, and this is in the comprehensive waiver only. And this is designed to provide clinical services to high-risk individuals with behavior needs. And that's used when all other methods have been exhausted and have not been successful. And the goal for this service is really to support that person to be successful in the community. Now, also with this intensive therapeutic residential habilitation service, it is a very specialized service for high-risk individuals. Because of the type of service and setting that it is, any setting for this service will have to go through a heightened scrutiny review process that's required by CMS, or Centers for Medicare and Medicaid Services, to ensure that it is not institutional in nature and that it does not segregate individuals from the broader community. And this service will be carefully monitored and supported by the division. We doing okay on questions? Good? None yet? None yet? Okay. Okay. So with needing to closely monitor the intensive therapeutic residential rehabilitation, we are requesting a 1915B4 waiver, and this waiver allows states to restrict providers from whom the Medicaid eligible may obtain services. So basically what that means is it's going to allow us to selectively contract with providers of intensive therapeutic residential rehabilitation. What we're going to do, and we want to do that because we want to make sure that they have the required skill set and that we're actually seeing quality outcomes for all the individuals receiving this service. The state's going to start out with a minimum of 2 providers, and then it will grow based on the service success and the capacity need. Okay, so now we're going to get into some definition clarifications that we're trying to clean up in the waiver renewal. There has been continued confusion about these services since at least the 2016 waiver renewals. So with the help of new additions in our service advisory team, we revised the language to better define the distinct differences between these 3 services. So personal assistance, that is specifically to provide ongoing support of activities of daily living and or the instrumental activities of daily living to the individual specifically. Then we have individualized skill development. This is for assisting individuals to learn specific skills necessary for independent living. And then we have community integration. It will be called community networking in the new waiver renewal. And this has been expanded just a little bit to make sure that we're assisting individuals to learn how to choose activities in the community that build social relationships specifically for that individual. So we hope that with these language clarifications, there will be, that will clear up a lot of confusion that's been going on and also provide expanded opportunity when we're thinking about the community networking piece. Additional clarifications include support broker, community transition, individual supported living, and professional assessment and monitoring. So support broker, that service assists people that are receiving self-directed services. And so we added that they can assist with navigating goods and services. For community transition, we have added clothing and internet service setup to the allowable expense list. And then we've also added TV service or media players to the exclusion list as essential furnishings. So we do not consider TV service or media players to be essential. Then for the individual supported living, if you have looked at our current service definition, there are probably 15 to 20 principles listed out. What we have done is we have streamlined and aligned those to the updated set of principles that are in our licensure and certification state regulations, and they align more closely with the home and community-based federal rule. So ensuring access to the community, promoting independence, and so those will align. So that is down from the 15 to 20 to like 4, but all of the details are included in the state regulation, and we tie it to that language. Then for our professional assessment and monitoring, we included a statement that says that the service is not intended for continuous care. I think that's something that there has been confusion in the past, thinking that that service could be used for shift nursing or that continuous care, and that is not the intent of the service. So we clarified that. All right, still good on questions? Mm-hmm. Okay, so some of our definition changes. We identified with stakeholders the need for changes in the assistive technology, crisis intervention, out-of-home respite, and environmental accessibility adaptation. So for assistive technology, it now has 4 components identified, and you would need to at least use at least one of them to access the service. We also added a cost of warranty at the time of purchase, and that it may include the internet service needed for the technology. For crisis intervention, we've included the development and writing of a formal intervention plan must be included with the service. And we also better defined crisis technician and crisis professional that are on your crisis teams. So a crisis technician would have a high school diploma, and operate under the direction of a crisis professional such as a psychologist, counselor, social worker, or behavior analyst that's licensed by the state of Missouri. And then, of course, your crisis professional would be that psychologist, counselor, social worker, behavior analyst that is licensed. All of the team members shall have at least 1 year of work experience in serving people with developmental disabilities and shall either within their previous work experience or separately have a minimum of 40 hours of training in crisis intervention techniques prior to actually providing the service. So very specialized service here again. Out-of-home respite, I'm excited about this one because this is one that we received feedback when we did our 2016 renewals, and it has taken us some time to work through all the logistics of it. But out-of-home respite, we are expanding to add a new provider type and setting. Currently, it is only allowed for group homes. So in the renewal, we will be expanding it to shared living host homes and relief homes, as well as standalone respite facilities. But I do want to note here that a host home provider shall not provide out-of-home respite if there's an individual currently residing in the home and receiving the host home services. A host home provider may provide out-of-home respite services if there is not currently an individual residing in the home and receiving the host home services. Then for environmental accessibility and adaptations, we added that the service can be used toward the purchase of an existing adaptation in a pre-existing, pre-owned vehicle. So this actually came up over this last year from out in the state. Someone found a vehicle that was a pre-owned vehicle that already had adaptations, and it was a perfect fit for them, and it was a good deal on the vehicle. So we did work with CMS, our Centers for Medicare and Medicaid Services, to allow this, but there are specifics when we do this. In the instances where you find a pre-owned vehicle that already has existing adaptations, the dealership or vendor must be paid directly by the state. The individual will not receive any Medicaid funding to make the purchase. The dealership and vendor must provide an invoice and purchase order that only includes the vehicle adaptations and not the vehicle. And the price of the adaptation must be comparable to market value and not include any labor costs. Okay, so for our employment services, we had some definition changes, and this was really about adding employment outcomes. So each of our 4 employment definitions have outcomes added to them. Career planning is a career plan discovery report outlining and summarizing their future employment supports, their skills, their interests and preferences. A plan for job development outlining strategies and actions that they need to engage in with potential employers. And then for job development, they need a monthly summary of job search activities, identification of ongoing supports to secure a job, and a job placement plan, which would include a job title, wage, projected number of hours to be worked weekly, and then how those implementation strategies are going to occur. And then for supported employment, it will be a monthly summary of professional observation and ongoing assessment of those paid and unpaid supports, so that way the individual can maintain employment. And then for pre-vocational, we want to make sure that identification of the skills are being developed, action steps needed to develop the skills, and then identifying those progress measures. And if you have specific questions about employment services, we do have Dwayne Shoemate on the call to help with any of those employments. He's our employment specialist or employment lead for the state. Okay, moving along. We're still okay on questions?
Yep.
Okay, quiet group tonight.
Yep.
Okay, hopefully you're liking it. We do have some limitation changes that we're making, and these are to the units and the time frames. And we really wanted to do this to allow more flexibility for individuals and families. So on this slide, you can see our units and time frames that we're adding to the renewal. For community networking, which is currently community integration, we have a limit of 25 hours per week and 5 hours per day. We are expanding that to 432 units per month to allow more flexibility, which equates to 108 hours a month. Then for individualized skill development, that is currently at 20 hours a week or 4 hours a day. We are expanding that to a monthly limit, so 348 units, which is about 87 hours. And then pre-vocational, currently that is a 6-month authorization, and so we're expanding that to an annual support plan year. And then with assistive technology and the service definition changes, we have new components. So we've added that you can receive one consultation per year, but an exception may be extended if the participant is pursuing a new or additional type of technology in the same year. And then we've also added that assistive technology support is limited to 40 hours per year. And we really want to thank our new additions team as well as other states and our assistive technology work group team that worked so much on this service definition. We really looked to other states on some of the most promising practices. So a lot of the effort with that has come through this service definition. So we are excited about that. And then crisis intervention. Right now, the crisis intervention service is a short term, but it's stated as like 4 to 6 weeks or 4 to 8 weeks. We are adjusting that to be 2,920 hours per year, and that aligns with the way that it's billed and provided. And so this 2,920 hours is approximately 4 months. And so that's going to provide more flexibility without having to do it within a set amount of 4 weeks or 6 weeks, but more flexibility for you to use it throughout the year as needed. Okay. On the next one, we've aligned the residential services and in-home service supports to reduce confusion and duplication. So the group home and ISL shared living services, ISL is your individualized supported living, those already include components of personal assistance, individualized skill development, or community networking. So they cannot be, you cannot get additional authorizations separately from those. So that will be a little bit of a change. But again, those services are already providing those components, so. Okay. The next one is hospital language that we've added to the service definitions, to a few of our service definitions, and some of them we are actually doing now in light of our COVID pandemic as well. So for individuals that are hospitalized, personal assistant, group home, individual supported living, applied behavior analysis, shared living, and shared living supports may be provided to assist with supports, communication, supervision, and any other supports that are needed if the hospital is unable to provide for them while the individual is in the hospital. The services have to be identified in the individual's person-centered service plan, and they can only be provided to meet the needs that are not met through the hospital services. They cannot be a substitute for the service that the hospital is obligated to provide through federal or state law or any other requirements. And it's designed to ensure a smooth transition between the hospital acute care setting and the home and community-based settings to preserve the individual's functional abilities. So we are excited about this change as well. Now the next one, we are putting in here in the renewal application right now, an amendment will actually come out sooner, so that's just not, it's not out yet, but you will see that here in the next couple weeks. In light of the impact of COVID-19, the division really needed to review its programs and its services. And through that review, the division identified 2 services where those needs could be accommodated through other means, and that would be our person-centered strategy consultation and counseling. Individuals' health and welfare will not be affected by this change, as the division will assist individuals and their support teams to address the needs through other appropriate waiver services that were previously less available due to the number of providers in some of the areas. What we have seen with the COVID pandemic and the ability to expand to telehealth services, that has offered a modality, an expansion of services that we did not have before. So for example, we have applied behavior analysis service providers. They have really increased, and their ability to provide more of their services through telehealth has occurred. And so they're able to reach out to other parts of the state that they were not previously available to reach out to. And the applied behavior analysis services include social skills group, family support, individual therapy. They do cognitive behavior strategies. And then in addition to that, we also have a resource at the division level that we provide to agencies and individuals. And this is our tiered supports process. And this is operated under the guidance of our regional office staff, our agency tiered support consultants, and they work with teams and provider agencies to assess implementation of positive strategies that affect and improve the quality of life for people. The tiered supports process really has the same goals and the functions as the Person-Centered Strategies Consultation Service. However, it was this Person-Centered Strategies Consultation was implemented prior to tiered supports. And so while the division has been building up the tiered supports process and have been able to maintain it, we can actually provide that assistance to all provider agencies that request it. Those tiered support processes also have the additional benefit of developing ongoing and continuous improvements, whereas the Person-Centered Strategies was a short-term service. So this will offer a longer-term option for people. Anyone that's receiving these services currently will be contacted along with the agencies that are providing the service and with the option to participate in the tiered support. Okay, still okay on questions? Okay, you guys are all hanging with us. We appreciate it. Okay, so here's another exciting change. We will no longer be allowing seclusion. Right now, that is permitted with specific criteria around it. With the waiver renewal effective July 1st, 2021, it will no longer be permitted. In the event of seclusion or timeout, if it's discovered or reported, there is a special review process that will be instituted, and we already have that outlined in our Division Directive 4.200. So it's a process that we've already been working on with providers and agencies and different waiver settings. So they're moving in that direction, but it will be complete by July 1st, 2021. Okay. And then to operate waivers, we have to meet a federal HCBS waiver assurance, and that allows us to continue to have the waiver services and to receive federal funding to meet the identified needs of the individuals that we serve. The division itself develops performance measures to show that the federal waiver assurances are being met, and the performance measures that we have are reviewed, and we revise them when quality monitoring processes are enhanced or with any additional data that we have available as we do those reviews. Performance measures, those revisions are a component of a continuous quality improvement plan or quality improvement. We have plans for those. And with the current waiver renewal process, revisions have been made to several of those performance measures under the qualified provider and health and welfare sections. So again, this is to ensure that we are meeting the health and safety of the individuals that we serve. And a lot of the changes we've made are just to align with the other waivers that we've already implemented, and some of them are, again, based off of what we have found as we've done our reviews. And with that, if there are any other questions or any questions, we are happy to answer them for you. I will tell you that if you want to take a closer look at these, they are posted. We have our draft waiver renewal documents are posted, and we give you the link here. And then we do have the current waiver applications if you'd like to review those. And if you think of something after this, this public forum, you are welcome to send any comments or questions to ddmail@dmh.mo.gov. And for the public comment period, we're taking those through the business day of Monday, August 17th. But again, at any time you have any questions or concerns, you can always email us. But if it's specific to this waiver renewal changes, please submit those to us by August 17th. Our next steps will be gathering all those questions and comments and looking to see if we need to implement any additional changes before we submit the official renewal application to MoHealthNet, our Medicaid agency. And then they will review it and process it for submission to CMS, or Centers for Medicare and Medicaid Services. They will have one additional formal public comment period. I anticipate that to happen probably around October. So this is not your only time, but you are welcome to send us anything.
So we do have a question.
Okay.
Can you provide some information about what types of things might be authorized under individual goods and services?
Okay, very good question.
Yes.
Yes, so I can jump in here, Angie. It's Janine. We had this question in an earlier session, and there are so many sort of
say, parameters around this, but in a nutshell, anything that would help reduce the need for, say, human existence. For example, you can purchase a microwave because you wouldn't need then someone to be, say, cooking for you. You can operate the microwave yourself. You might purchase a Ring doorbell as well because that would necessitate not needing someone there to answer the door, see who's coming. You can also get a membership at a gym if you, instead of receiving, services from a nutritionist, for example. So those are three that I thought about after our last call.
Those are perfect. Very good examples. Thank you.
We have another question.
Okay.
Can you address the lowering of the criteria for case managers to a registered nurse or BA, any BA, not human services related field with no experience?
Can you repeat that question? I'm not sure if I'm...
Sure. Can you address the lowering of the criteria for case managers, I'm wondering if that means coordinators, to a registered nurse or BA, any BA, not human services related field with no experience?
Okay, so that's not part of our waiver renewals. That is a state plan service. And so that was, I don't have that language right in front of me. We will get back to you on that. I don't have it right in front of me, so I don't want to tell you the wrong thing. But that is part of our targeted case management services, and those requirements are outlined in our state plan and not in our waiver renewal. So we will get that for you. I will say that I don't think it was a lowering of requirements. It was just a wording change. So it wasn't so specific on some of the types of classes that people had to take, but we'll get to that. Do you have another one?
I don't see it. Oh, got another question.
Okay.
It previously was education, psychology, social work, human services, nursing, therapy.
Yes. Yep. Like I said, we will. We'll get back to you on that one. We'll pull up our state plan language. We do appreciate the question. Okay, we do want to go back and while we're waiting for some more questions to come in, we are going to go back and just explain a little bit more on performance measures because we think it's an important component. Yeah. So I'm going to let Kim Stock, our Quality Enhancement Director, talk about that.
Thanks, Angie. And good evening, everyone. Just want to clarify on the second bullet. We highlighted that the performance measure changes under our assurance for qualified provider as well as health and welfare. I just wanted to make sure that we did note and indicate that with the waiver renewal process, we did make also some performance measure revisions under our level of care and under our planning assurances as well.
Okay. Thank you, Kim. Okay. Well, we'll wait a few more minutes to see if any other comments come in, but we do want to thank you for your time tonight. I know it was really hard to not get out and see people, so the virtual opportunity, we've learned a lot with virtual. So thank you all very much. I know it's not as easy, but we do appreciate the fact that you've joined us and that you have questions and that we were able to talk through it. Again, if you can't think of it tonight, but you think of it later tonight or tomorrow or anytime, feel free to send us an email. I know that I'm one of those that sometimes afterwards I'm like, oh, I should have asked. So. Okay, well, I think with that, we will let you all get some more time back to your evening. Again, appreciate your time this evening and hope everyone stays dry. I know it's getting ready to storm here, so thank you all very much, and we'll get these responses back out to you. And then also, we are having, I should have told you this sooner, I apologize. We had a forum today with our providers. We had our forum with you tonight, and then tomorrow we have a forum with our targeted case management entities. And so once we finish all of those forums, we will take all of the questions and comments that we've received and put them in a document and post them on our website for you to review. And so we'll also include the comments that we received by email as well, and then our responses and if we've made any changes to the waiver applications based off of those responses. So again, thank you so much for your time tonight. We really appreciate it, and have a good night.